Are you curious about the versatile medication, Divalproex? Look no further, as we delve into its primary uses, dosage instructions, side effects, and user opinions. Divalproex is a medication with a wide range of applications, making it essential for various medical conditions. Primary conditions treated with Divalproex. Divalproex, also known as sodium valproate, is primarily used to treat seizure disorders such as epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures, which are sudden bursts of electrical activity in the brain. Divalproex helps to stabilize these electrical impulses and reduce the frequency and severity of seizures. In addition to epilepsy, Divalproex is also effective in managing manic episodes associated with bipolar disorder. Bipolar disorder is a mental health condition that causes extreme mood swings, including periods of mania characterized by elevated mood, increased energy, and impulsive behavior. Divalproex helps to stabilize mood and prevent the occurrence of manic episodes. Furthermore, Divalproex is prescribed as a preventive medication for migraines. Migraines are severe headaches that can be accompanied by other symptoms such as nausea, sensitivity to light and sound, and visual disturbances. Divalproex helps to reduce the frequency and intensity of migraines, providing relief for individuals who suffer from these debilitating headaches. Dosage instructions for Divalproex. The dosage of Divalproex varies depending on the condition being treated and individual patient factors. It is crucial to follow the prescribed guidelines provided by your healthcare professional. Typically, Divalproex is taken orally in the form of tablets or capsules. For the treatment of epilepsy, the initial recommended dosage for adults is usually 10-15 mg per kilogram per day, divided into 2 or 3 doses. The dosage may be adjusted based on the individual's response and tolerability. For children, the dosage is based on their weight and age, and it is important to adhere to the specific instructions given by the doctor. When used for the management of bipolar disorder, the initial recommended dosage for adults is usually 750 mg per day, divided into 2 or 3 doses. The dosage may be adjusted based on the individual's response and the desired therapeutic effect. It is important to regularly monitor blood levels of Divalproex to ensure the dosage is within the therapeutic range. For the prevention of migraines, the initial recommended dosage for adults is usually 250 mg twice daily. The dosage may be increased to achieve the desired effect, but it should not exceed 1,000 mg per day. Regular monitoring and communication with your healthcare professional are important to ensure the optimal dosage is being administered. Potential side effects of Divalproex. Like any medication, Divalproex can cause side effects. However, it is important to note that not everyone experiences these side effects, and they tend to be manageable with proper medical guidance. Common side effects of Divalproex include nausea. Some individuals may experience feelings of nausea, which can be alleviated by taking the medication with food or as directed by your healthcare professional. Dizziness. Divalproex can cause dizziness, especially when standing up quickly. It is important to take precautions and avoid activities that require alertness until you know how the medication affects you. Drowsiness. Divalproex may cause drowsiness, making it important to avoid driving or operating heavy machinery until you know how the medication affects your level of alertness. Hair loss. In some cases, Divalproex may lead to temporary hair loss. This side effect is usually reversible once the medication is discontinued. It is important to discuss any side effects with your healthcare professional, as they can provide guidance on managing or mitigating these effects. In some cases, adjusting the dosage or switching to an alternative medication may be necessary. User opinions and experiences with Divalproex. To gain a better understanding of Divalproex, let's explore user opinions and experiences with this medication. Real-life user perspectives can provide valuable insights into its effectiveness, tolerability, and overall satisfaction. User A, who has been taking Divalproex for epilepsy for several years, reports a significant reduction in the frequency and severity of seizures. They mention that Divalproex has allowed them to live a more normal life and feel more in control of their condition. However, they do highlight the initial adjustment period, which involved experiencing some side effects such as drowsiness and dizziness. Overall, User A expresses high satisfaction with Divalproex. User B, who takes Divalproex for bipolar disorder, shares a similar positive experience. They mention that Divalproex has helped to stabilize their mood and reduce the occurrence of manic episodes. User B notes that they have experienced minimal side effects and are satisfied with the overall effectiveness of Divalproex in managing their condition. User C, who uses Divalproex for migraine prevention, reports a significant improvement in their quality of life. They mention that the frequency and intensity of migraines have decreased since starting Divalproex. User C also notes that they have not experienced any major side effects and are grateful for the relief provided by this medication. It is important to remember that individual experiences with medications can vary, and what works well for one person may not have the same effect on another. Therefore, it is essential to consult with a healthcare professional to determine the most appropriate treatment plan for your specific condition. Alternatives to Divalproex for primary conditions. While Divalproex is an effective medication for the primary conditions it treats, there may be situations where an alternative treatment is warranted. It is essential to discuss any concerns or considerations with your healthcare professional to determine the best course of action. For epilepsy, alternative medications such as carbamazepine, lamotrigine, or levetiracetam may be considered based on individual factors and treatment goals. These medications work by different mechanisms to control seizures and may be more suitable for some individuals. In the case of bipolar disorder, alternative medications such as lithium, antipsychotics, or other mood stabilizers may be prescribed, depending on the individual's response and tolerability to Divalproex. Each medication has its own set of benefits and potential side effects, so it is important to weigh the options and make an informed decision with the guidance of a healthcare professional. For migraine prevention, alternative medications such as beta blockers, calcium channel blockers, or antidepressants may be considered. These medications work by different mechanisms to prevent migraines and may be more effective for some individuals. Precautions and considerations when taking Divalproex. Before starting Divalproex or any other medication, it is important to consult with a healthcare professional. They will evaluate your medical history, current medications, and any potential contraindications or interactions. Precautions and considerations to keep in mind when taking Divalproex include pregnancy. Divalproex can cause birth defects and should not be used during pregnancy unless the benefits outweigh the risks. It is important to use effective contraception if you are of childbearing potential. Liver function. Divalproex can affect liver function, so regular monitoring of liver enzymes is necessary. Individuals with liver disease may require a lower dosage or alternative treatment. Pancreatitis. Divalproex can rarely cause pancreatitis, which is inflammation of the pancreas. Symptoms may include severe abdominal pain, nausea, and vomiting. It is important to seek medical attention if these symptoms occur. Drug interactions. Divalproex can interact with other medications, including certain antidepressants, anti-epileptic drugs, and anticoagulants. It is important to inform your healthcare professional about all medications you are taking to avoid potential interactions. Common misconceptions about Divalproex. There are several misconceptions surrounding Divalproex that should be addressed. One common misconception is that Divalproex is only used for epilepsy. As discussed earlier, Divalproex is also used for the management of bipolar disorder and the prevention of migraines. Its versatility makes it an important medication for various conditions. Another misconception is that Divalproex is addictive. Divalproex is not addictive, and there is no evidence to suggest that it leads to dependence or withdrawal symptoms when discontinued. However, it is important to follow the prescribed dosage and not abruptly stop taking the medication without consulting your healthcare professional. Consultation with a healthcare professional before taking Divalproex. Before starting Divalproex, it is crucial to have a thorough consultation with a healthcare professional. They will assess your medical history, perform necessary tests, and evaluate the appropriateness of Divalproex for your specific condition. They will provide guidance on dosage instructions, potential side effects, and any necessary precautions. Your healthcare professional will also monitor your progress and adjust the dosage if needed. Regular follow-up appointments are important to ensure the medication is effectively managing your condition and to address any concerns or questions you may have. Conclusion. Divalproex is a versatile medication used to treat various medical conditions, including epilepsy, bipolar disorder, and migraines. It is important to follow the prescribed dosage instructions and consult with a healthcare professional to ensure safe and effective use. While Divalproex can cause side effects, they are generally manageable with proper medical guidance. Real-life user opinions and experiences provide valuable insights into the effectiveness and tolerability of Divalproex. It is important to consider alternatives to Divalproex based on individual factors and treatment goals. Precautions and considerations, including pregnancy, liver function, and potential drug interactions, should be discussed with a healthcare professional. By understanding the primary uses, dosage instructions, side effects, and user opinions of Divalproex, you can make informed decisions about your healthcare and work together with your healthcare professional to manage your condition effectively.